Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California. A radio show and podcast where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Sheikh. Healthcare environments can be intense. People come in sick or need complex procedures. Teams of clinicians with a range of skills and expertise interact with each other and with patients and their families who each have unique circumstances. A lot happens, sometimes very fast, and the stakes are high. So how do we figure out when things go wrong, and how do we learn from these incidents to prevent them from happening again? Incident reporting systems are used by many healthcare organizations to track adverse events or high-risk situations. The premise of these incident reporting systems are that frontline healthcare staff who are directly involved in events that adversely affect or could affect patients voluntarily report these events using a centralized process at their healthcare organization. These systems are meant to give healthcare facilities critical insights that could help them prevent or reduce risks to patients and learn from these incidents. Incident reporting systems work best when, in addition to reporting adverse events, healthcare staff also report near misses. These are instances where things could have gone wrong but were fortunately picked up before harm actually reached the patient. In this episode, we talk about adverse event reporting and learning systems in hospitals, clinics, and pharmacies. Adverse events and near misses in healthcare are underreported all around the world. What makes the evening news is just the tip of the iceberg. Incident reporting systems in hospitals are surveillance systems whose goal is to pick up potential problem areas. But one issue is that they rely on voluntary reporting. There are many reasons healthcare staff may not report these incidents. For example, an organizational culture of blame or shame, a fear of repercussion, or a perception that reporting would take too much time away from their other patient care tasks. Healthcare staff also need to believe that they're taking the time to report these issues during their busy workday really changes things for the better. There are healthcare systems around the world working hard to change the culture of reporting these incidents. They're doing this by recognizing that medical errors and incidents are more often than not a product of problematic organizational cultures, rather than solely because of one person. Moving the focus from who caused the problem to what went wrong encourages reporting and learning from events. So does closing the loop and communicating to healthcare staff who reported incidents how things improved at a system level as a consequence of their report, and recognizing employees who report patient safety hazards that changed care for the better. Our guest in today's episode of Mapping Healthcare is Professor Shin Ushiro, who is the Chief Patient Safety Officer at Kyushu University Hospital in Japan. Shin has worked for years with the Japan Council for Quality Healthcare, or JQ, on building and improving a national adverse event reporting and learning system in his country. The views expressed on the show are mine and those of my guests. So Shin, welcome to the show. You work with the Japan Council for Quality Healthcare, or JQ. So let's talk specifically about the work that JQ has been doing on incident reporting and learning health systems in Japan. You've been leading this work for nearly 2 decades. I was reading about the history of Japan's patient safety journey, and I read that in the late 1990s and the early 2000s, there were several medical incidents that received media attention there, which spurred some significant changes and ultimately led to the formation of the Japan Council for Quality Healthcare. So tell us about some of those incidents and the national response and policy changes from those cases.
Thank you very much, Ulfat. And what happened the year of 2000 and around was a fatal and deadly medical accident, even in prestigious hospitals in my country. There were a couple of cases which were highly publicized by Japanese media. So I said there are a couple of cases. Number one, the patient A and the patient B were completely switched. Patient A was supposed to undergo heart surgery, but patient B, lung surgery. So the type of surgery were completely switched. Number two is a case in which patient were dead, unfortunately. Patient underwent hand surgery And after that, patients were supposed to undergo drip infusion of heparin solution. However, the nurse in charge mistakenly injected disinfectant solution instead of heparin. Both solutions are transparent, no color. So she mistook. And then number three, I'd like to talk about the humidifier of ventilator. There were two different tanks close to the ventilator. One contains water, another one contains ethanol. So the nurse mistakenly injected the ethanol to humidifier. So patient inhaled ethanol for 2 days, and then patient were dead, unfortunately. So Japanese people believed that prestigious hospitals provide safe management. However, the anxiety and the intense concern on patient safety mounted in our society at that time. So in response to the growing concern on patient safety, the Japanese government published a national policy on patient safety in 2002. It included reporting and learning system at the institutional level and the national level.
Thank you for sharing that, Shin. And that really helps me appreciate the long journey that, many countries have faced similar journeys where there's been a reckoning about the issues around patient safety and national bodies that have been formed in response to those issues. So, the Japan Council for Quality Healthcare's work on the national reporting and learning system includes analyses, alerts, and a database of patient safety, adverse events, and near misses. This work continues to expand over time, and another program introduced was the Japan Obstetric Compensation System for Cerebral Palsy. This is a no fault compensation system for birth injury. Japan, I was reading, was facing some severe resource constraints in perinatal medicine. There was a lot of burden on physicians and midwives. And because of that, there was a shortage of young physicians specializing in obstetrics, which further worsened this growing crisis. So tell us about the Japan Obstetric Compensation System for Cerebral Palsy. What was achieved by introducing this program in Japan and how it has improved maternal and child safety over the past few years?
As you said, nearly 20 years ago, we suffered the shortage of obstetrician and neonatologists, mostly because of rising lawsuit case, particularly lawsuit case related to cerebral palsy and the management of neonatal period. And so the health minister launched a study group in the ministry, and the study group concluded that no-fault compensation system deserves to consider. And then leading political party came to the ministry and they also launched a study group and they concluded that no-fault compensation system should be in place in our healthcare system in my country. And then government political leaders came to JQ to be operator of the no-fault compensation system. The system provide no-fault compensation. It's a monetary compensation as well as publishing investigative report and carry out preventive action. The patient group were included in the introductory committee, and they emphasized that just the money doesn't satisfy them. Prevention, investigation and prevention will satisfy the victimized patient and family. So the framework includes not only financial compensation but also investigation and prevention. And we launched the new system in 2009. At one time point, we made a comparison study using the batch of investigative report in some year, and we compared it to different year. And then we concluded that several clinical procedures that take place during delivery is improving. For instance, fetal heart rate monitoring interpretation is improving, and excess amount of uterine contracting agent like oxytocin is less frequent, and the neonatal resuscitation is more often. So we concluded that we are keeping on improving the procedure. And the number of profound cerebral palsy eligible for this system is dramatically decreasing. Particularly initial 5 years, it dropped dramatically. So the Japanese society welcomed this system and touted this system. Even Supreme Court of Japan touted this system.
As you know, I'm a pediatrician and so have seen and experienced that whole spectrum of events from being a physician in the delivery room to then taking care of kids with chronic conditions and seeing the impact of cerebral palsy on families. And pretty much it's a lifelong journey that families face. So, really important program. And thank you for sharing your experience about that. So, Shin, you're a medical doctor, surgeon by background, and the chief patient safety officer at Kyushu University Hospital in Japan. There, you've worked on a wide range of quality and safety improvements, such as incident reporting system, hospital accreditation, and ways to improve communication with patients and families in challenging situations. You're also an advisor to the health minister of Japan. So tell us about how you got interested in healthcare quality and patient safety and your career journey to your present role.
As you said, I'm originally a surgeon, but the uniqueness of my career is working as a government official in the Ministry of Health. There was an exchange program between university, the medical center, and the Ministry of Health at that time. So I worked 2 years and 6 months in the Ministry of Health in charge of cancer control and control of cardiovascular diseases and tobacco control as well. And then I learned skills of running national project in the ministry, and I came back to work as a surgeon in my hospital. However, the concern on patient safety was mounting in our society. So JQ called me back for running national reporting and learning system, which was subsidized by the Japanese government and regulated by the government ordinance. And then I started my career on quality and safety in JQ, and I spent nearly 10 years in JQ running reporting and learning system, no-fault compensation system, and a little bit engaged with hospital accreditation. And at that time, my university hospital called me back to work as a patient safety officer because patient safety is a really big issue, particularly for university medical center. If hospital fails in the area of patient safety, total activity of hospital stops. That's what is going in my country. So I began a new career in my hospital, but JQ do not want me to leave for the university hospital. So I work in two workplaces, traveling back and forth between two organizations.
That's a long and winding journey and really gives me a good picture about, your solid foundation as a medical doctor, surgeon, and then how you've branched out into really working at a really high level on a range of issues, right? Like not just surgical issues, but obstetric issues, child health issues, just a range of safety concerns that you've worked hard to mitigate. So, you were on the board of the International Society for Quality in Healthcare, or ISQA, from 2017 to 2024. And with all your international work there and beyond, you've gained some valuable perspectives on incident reporting systems around the world. What are some specific cultural or structural contexts in Japan that your team had to consider as you developed systems to respond to patient safety events and to prevent them?
First, I'd like to focus on structural issue. If we carry out incident reporting system, we need a system at institutional level, incident reporting system. Unfortunately, we Japanese people love government regulation. We love discipline. So the Japanese government issued a government ordinance to mandate to embed incident reporting system at all the medical institutions, including clinics, including hospitals. And then so the structure is in place in my country. And then next I'd like to talk about the culture. The similar to medical professionals in other countries, our medical professionals do not like to report the incident case internally or externally. But we embedded incident reporting system under the government regulations. So I thought I need to convince medical professionals in my country to report internally and externally. So I established the two principles particularly for JQ's external reporting and learning system. Those are no blame reporting principle. And the second principle is anonymous reporting. because the medical professionals do not want to report for fear of being blamed or for fear of being sued. So I proposed those two principles, and I traveled across my country and I delivered lectures on reporting alarm system for maybe 40 to 50 times a year. And then the number of reporting gradually increased. Initially, I thought that this system may not be successful. However, it has been very successful. So the Japanese government tried to launch equivalent system covering other medical institutions like community pharmacy and dental clinic as well.
Important points that you raised about the culture of incident reporting systems and the amount of work it takes to actually get them going and to reduce the
Mm.
stigma and blame and shame and
Yes, yeah,
fear around these reporting systems. And it's a worldwide challenge. And it's interesting to see that it's the same in many countries,
yeah.
right? So, once incidents are reported, what's next? How does the Japan Council for Quality Healthcare, JQ, support learning from these incidents to help reduce the chance of similar issues recurring?
I might have missed to mention the feedback, but the feedback is a key issue for successful reporting and learning system. So once we get reporting, we put all the cases on collective analysis and qualitative analysis. And then we issue periodically, for instance, we issue quarterly report, including statistics like tables or figures, as well as thematic analysis. Thematic analysis is analysis such as the overdose of insulin or mistake in double checking or error that happened at the transition of care, the admission or discharge, things like that. So the medical professionals are very much familiar with those events taken up in thematic analysis, so they like it very much. And one of the most popular feedback of our reporting and learning systems is monthly alert. Our monthly alert is just 2 pages long. It includes incident that actually happened, which is very convincing. And we Japanese people loves animation cartoons, so we include cartoons. So the cartoon conveys very important message, key messages instantly to Japanese medical professionals who are familiar with animation and cartoons when they were child, like me. Our monthly alert is really popular. We have 8,000 hospitals, many hospitals in my country, and 10,000 clinics and 68,000 dental clinics. All of them knows about our monthly alert. It's so popular. And last but not the least, we provide a database of adverse event and near miss event. 150,000 adverse event and near miss event are saved in our database, and everybody can have an access to our database. And our database, the identifier is deleted, so it's anonymous. And in recent years, AI, artificial intelligence researchers, have an access to our database, and they are developing AI models that analyzes incident on medication safety. So the database is powerful too as a feedback. With those feedbacks, our incident reporting and learning system has been very successful.
Yeah, that was really interesting. I'm looked back to your example of using cartooning and manga in communication, which I didn't
Very
know
good.
that that was done. So that was really interesting. And then, of course, you spoke about artificial intelligence and how that's now being used to identify and work on some of this. You've also worked on a national adverse event reporting system for community pharmacies. What are some patient safety issues that you find are reported by community pharmacies in Japan? And can you talk about an initiative briefly that JQ has helped implement to help with this issue?
Our reporting and learning system targeting hospital and clinic has been very successful. So the Ministry of Health, particularly the Division of Pharmacy Regulation, came to JQ, and we launched a new system to cover community pharmacy. And then initial years, they report errors that take place during dispensing, sort of a counting error or the mix up of drugs However, after those years, the pharmacy noticed that our definition includes questionable prescription and clarification. The error happens in clinic or hospitals, and then error is identified in community pharmacy, and then community pharmacy calls doctors on the phone, and then they clarify, and most of the prescription is corrected by community pharmacy. That happens very often. The community pharmacy likes to report those clarification issues because it's sort of their successful story, and it's appealing to our society. So now the clarification issue accounts for 80% of all the reports, and the 20% is related to dispensing, and the other 1 or 2% is related to the sales of pharmaceutical products like insulin needle or insulin injection syringe or drip infusion bag, things like that. So we learned a lot that the clarification by community pharmacy is crucial for patient safety. That's one of the biggest achievement in the reporting and learning system.
And the reason it's really important is, when I first started training about quality improvement, some of the principles we were taught was the Swiss cheese model. And,
Yeah.
that was published by Dr. James Reason, who recently passed away. But he basically laid the groundwork for that. And what that says is that errors pass through the holes in the Swiss cheese. And at each step, you want people to block them. And I think community pharmacies play an important role when they call to clarify prescriptions. So these errors are caught before they reach the patient. So that was a really important initiative that JQ assisted with. The first time we spoke was when you interviewed me for the ISQA board position. I remember it was a video interview with a panel of interviewers from around the world, and you were in a crowded Tokyo train. I could see you
Yes.
walking through the train. So clearly, you're a man who's always on the go. So, what's a project initiative you've recently started working on that we should be aware of?
My recent project is reporting and learning system targeting dental clinic. There are wide range types of errors happens in dental department. For instance, the wrong tooth extraction take place occasionally. The tooth is not always clearly visible in oral cavity. Some are completely embedded in gingival tissues. So the dentist wrongly extract wrong teeth occasionally. And then they use many types of medical devices, and some are broken, and the patient ingest the parts of those medical devices, or some parts are migrated into gingival part, but we cannot remove it because there is a very important nerve running in gingival tissues. So all those events are happening in my country, but those events are not visible to Japanese society, but it's getting visible through our reporting and learning system.
I'm sure your patients and your colleagues are grateful that you're involved in this work. And finally, in the show, we like to learn more about the place our guest lives or works in. So, you work at Kyushu University Hospital, which is in the city of Fukuoka on the north shore of Japan's Kyushu Island. The area I was reading is known for its beaches, its
Mhm.
ancient temples. And I read that one of those temples, Shofukuji, is the oldest Zen
Mhm.
temple in Japan. Its founder was monk Aisai, and he established a sect of Zen Buddhism, and he also was responsible for bringing tea culture to Japan. So tell us some more about Fukuoka. What are some of the things a first time visitor to the area should experience there?
I'm really honored to introduce the city of Fukuoka, where I live and work for more than 30 years. And Fukuoka is one of the biggest city in my country with 1.66 million population. And it's a really historical city. And it's located at the north end of Kyushu Island, close to Korean Peninsula and China. That Japan and Korea had been very much affected by China culturally and other issues as well. Fukuoka is located close to China, Korea, and Tokyo, so I often visit Incheon Airport in Seoul for transit. So it's really convenient for Asian people to visit. And then, as I said, Fukuoka was, and the north end of Kyushu was open to the China and the Korea historically. So we got many knowledges and administrative things and cultures from China. And then Eisai, Monk Eisai was one of the person who came back to Fukuoka from China with knowledges and experience of Zen. Actually, in the city of Fukuoka, there are two different districts. One is Fukuoka district, which is administrative, governing district. And then another district is business district, which is called Hakata. So the name of the city is Fukuoka, but the name of the central station is Hakata Station. The business person of Hakata district built big temple for Eisai to spread the idea and spirit of Zen in Fukuoka area and across my country. And then so we see many temples in Fukuoka as well as shrines. If you visit Eisai's temple, it is called Shofukuji. It takes just 10 minutes from Hakata Central Station. So please visit Fukuoka and you will experience a spirit and taste of Zen and food and culture.
And yes, I was actually really surprised to learn that Kyushu is actually significantly closer to both Korea and China than it is to Tokyo. And it's the part of Japan geographically that's nearest to the Asian continent. And that was news to me as I looked up the area on the map. So that's all the questions I have for you, Shin. And I wanted to say thank you so much for taking the time to talk to me today and being on Mapping Healthcare.
Yeah, thank you. Thank you very much. Bye-bye.
That was Professor Shin Ushiro from the Japan Council for Quality Healthcare, or JQ, telling us about Japan's journey in setting up a national medical adverse event reporting and learning system. You heard about the range of patient safety issues that incident reporting and learning systems can help prevent, and you also heard about how it is important to consider cultural, organizational, and political contexts in developing systems to respond to patient safety events. All right, that's all I have for you today. This was your host, Dr. Sheikh. You were listening to Mapping Healthcare on KDRT 95.7 FM, where we explore healthcare around the world, highlight people who improve it, and share what we can learn from them. This episode featured music by Hitomi Moriwaki. You can hear Mapping Healthcare around the world anytime on kdrt.org and wherever you get your podcasts.
Say